about coronavirus, how quickly that changes. I wish to thank His Excellency the President for the confidence placed in me and a myriad of people who he has honored to work in this steep journey. Indeed, were it not for our healthcare workers, the leadership at the Ministry of Health, the National Emergency Response Committee on Coronavirus, the Command Center, and the interministerial teams who put in and continue to put in endless hours to ensure the safety of all Kenyans, our situation would have been dire. I would wish to take a special thank you to the Fourth Estate, you members of the media, for the unwavering support you have given us in those 100 days when it comes to highlighting all matters related to COVID-19, for giving us your airtime, for helping us in spreading the truth on behalf of NAC and the Health Ministry, and indeed all Kenyans. And on my own behalf, I would like to say thank you. We are greatly indebted to you. Last but not least, I would also like to thank my fellow Kenyans who, by and large, have heeded instructions, stayed at home, social distance, worn masks, and kept our nation fairly safe. But where are we now, fellow Kenyans? We have come a long way since our first patient was confirmed. To begin with, they threw a spanner at the perception that COVID-19 was a disease of the elderly and brought to light the fact that it would affect anyone, including the young, who represent a significant percentage of our national population. They also illuminated the fact that as a country, one that had only 8 infectious disease beds, we were ill-prepared to deal with an epidemic such as COVID-19. In 100 days, and with the disease now affecting 40 out of our 47 counties, including refugee camps, our bearings are clear and direction determined, because indeed, as I paraphrased at the beginning of this journey, mtakasha mvunguni sharti ainame. We have put in the work and we will continue to do so, taking note of and learning from challenges and failures we have experienced since this journey began. It is noteworthy that when COVID-19 struck, Kenya had never had a situation that required the mass quarantining of individuals, and we therefore did not have a framework for it, the experience on how to deal with it, and regulations on whose responsibility lies where. We also did not have the reagents and testing kits that are an essential part of managing the epidemic, and along the rest of the world had to begin the competitive process of procuring them together with PPEs that are critical for the protection of our warriors. Between this and the capacity shortages in human resources, medical equipment, physical infrastructure, preparedness seemed a daunting task. We had to adapt and learn quickly, largely through trial, tribulations, and innovation that particularly impacted our quarantine system. We are aware that we inconvenienced many of you in the process, and for that, I would like to offer my apology with assurance that our systems are now much better and practical. We are still learning. That we are in the midst of a crisis and going through a battle is something we now understand very well. COVID-19 has badly weakened our economy, cost us jobs, and impacted our business, particularly those in the informal sector. But we are forging on and continuing to balance economic concerns with the preservation of lives. Thanks to President Uhuru Kenyatta and the measures he has taken and directed, we are recovering and we will continue to do so. We started with an 8-bed infectious disease capacity, developed 120-bed capacity at Bagathi, quickly converted over 500 beds at the Kenyatta University National Hospital for COVID-19. We cascaded capacity to the county levels where COVID-19 has effectively triggered the transformation of the healthcare system in the country and underscored the importance of coordination between the national and county governments. There are many commendable examples of counties that have committed themselves to the rapid building of capacity. We congratulate them and remain confident that in the next 2 weeks, all counties will have at least 300 isolation beds as directed by President Kenyatta. Let us not forget that healthcare is a devolved function and that national assistance notwithstanding, every county is tasked with preparing to provide the necessary services. We have provided guidelines for safe service provision, including establishing that appropriate PPEs are available in all health facilities and to all community health volunteers, and that all health workers understand safety protocols. At the same time, we have built capacity and self-sufficiency in manufacturing of PPEs as part of our COVID-19 response. We have factories now producing PPEs in Kenya, and our capacity to manufacture and supply hand sanitizers has surprised many. Fellow Kenyans, I'm sure that you have also noticed the significant increase in testing capacity. We have pursued and continue to do so numerous channels to ensure that the coming weeks the capacity is bolstered even more. Just to highlight how we have progressed month on month and where we are today. In March, from the date that we announced, we did 3,419 samples were tested, out of which 78 were positive. In the month of April, 19,108 samples were tested, 328 testing positive. In May, 57,527 samples were tested, resulting to 1,615 positive cases. As at June 21st, 59,958 samples have been tested, with 2,717 testing positive. These figures demonstrate that the number of samples tested increased as we upgraded our testing capacity. Following recent financial allocation from the national government, and as a result of additional funding we have received from development partners, local well-wishers, we now have greater capacity to combat COVID-19 by enhancing not just our testing capacity, but also our distribution of free masks to the vulnerable communities and tracing mechanisms at cross-county and national border levels. We have also hired, during that same 100 days, an additional 4,509 healthcare workers to operate the 189 ventilators that we have distributed. Fellow Kenyans, well beyond the safety and containment measures we have undertaken as a government, there have been many unforeseen challenges related to COVID-19. One of those is a silent, invisible killer that is affecting our nation and indeed the globe, and that's depression. As with all pandemics, COVID-19 has affected our lives, and particularly our mental health, in ways untold. For some, the public health actions we have taken, such as social distancing, have brought about anxiety and feelings of isolation, while for others, the containment measures we have yielded feelings of suffocation. We are sensitive to this, and we have put in place systems that respond to it and that we have mentioned continuously, and we will be discussing in detail over the next few days. But what then is the way forward. Fellow Kenyans, by now it is evident that, like many other diseases, the coronavirus will be with us for a long time, and that it will, in all probability, eventually stretch our medical system just as it has globally, even in the wealthiest nations. Now the time has come for us to take personal ownership and responsibility of this disease as never before. The more the government de-escalates measures, the greater the responsibility we will each have to assume. It is with this in mind that the Ministry of Health has developed guidelines and protocols supporting the home and community-based isolation and treatment program, for which we will be implementing going forward. Our shift to this form of caring for our loved ones in an environment that is familiar and comfortable to them has been informed by both our traditional support system and the international best practices being applied to COVID-19. It is a more practical approach to managing COVID-19 in that it calls for increased personal responsibility and eases undue burden to our hospitals. It will be applicable to those exhibiting the necessary infrastructure in homes and elsewhere. The 100-day milestone is bittersweet. We mourn the 123 lives we have lost to date and celebrate the fact that we are better equipped for and more informed to combat COVID-19 than before. I can proudly say that though we have not won the war yet, we are ready to fight the battle and come out victorious. Let us recommit ourselves with determination to continue fighting without tiring or giving up. Fellow Kenyans, there is a silver lining to everything. We have seen change in our behavior, some of which will outlast coronavirus, I would like to believe, such as increased levels of hygiene, the use of technology, which we have enhanced substantially, all the way to virtual meetings, local and international. But also, we have seen increase in creativity, such as children talking about Yulem to Corona. And on this 100th day, even as you enjoy that special meal, you know which one, the one sausage and 2 beers. Let us protect our loved ones by thinking of ourselves as watu wa Corona. Because as I've stated before, I can get it, you can get it. Get it? Today, we have registered 260 positive cases, just to illustrate my point. That's the highest number from a sample of 3,651 in the last 24 hours. That means that we now have a total of 4,738 positive cases in the country. Cumulatively, 140,000 samples have been run so far. And out of these 260 positive cases, 254 are Kenyans, while 6 are foreigners. 176 are male, 84 are female. The youngest case is a 7-month-old infant, and the oldest is 90 years old. You will get the distribution of this in the press material that you are going to get from here, but Nairobi and Mombasa continue to be the main culprits, with Nairobi standing at 157, Mombasa 42, Kwale 15, Kiambu 14, Machakos 9, Kajiado 7, and others following with lesser figures. On a positive note, we have discharged 21 more patients from our various testing facilities. And ladies and gentlemen, I also note sadly that we have lost 2 patients from the disease, bringing the cumulative number of fatalities to 123. I would also like to mention that we have also now launched the home care system by discharging a substantial number of people from hospitals. For example, from Kenyatta University, we have discharged some 338 persons who are positive for home-based care after the 14-day period recommended by the World Health Organization. From Coast General Hospital, we have discharged some 212 persons, and we are still getting reports from other hospitals as they discharge these individuals, which means that we are probably about 600 persons who have been discharged from various hospitals to be taken care of at home. As I conclude, fellow Kenyans, allow me to wish each and every father out there a very happy and blessed Father's Day. As one of you, I can totally relate to the fact that when all is said and done, and I quote, "Heavy is the head that wears the crown," end of quote. As the heads of our households, we carry the responsibility of building and securing our family's welfare, and we make tremendous sacrifices to do this. Brothers, in this COVID moment, let us remind ourselves of this responsibility, and as fathers, go the extra mile towards protecting our children, because we are not only responsible for what we do, but also for what we fail to do. Wouldn't it be loath to make all the financial, emotional, and physical sacrifices we do only to let our children perish and our families perish, or struggle from COVID-19 because we did not shield them with the necessary activities that we need to put in place? These 100 days have been 100 days of challenges. They have been 100 days of caring and reconnecting with family and community. There have been 100 days of business supporting us in the ministry and as Kenyans. Indeed, there have been 100 days of learning and gaining knowledge. Knowledge, as they say, is power. So let's lift our responsibility and say that power will come in social distancing. Power will come in hand washing. Power will come in mask wearing. Power will come in sanitizing. May God give us power to save Kenyans. May God give us power to win this war. I thank you. Before I take any questions, I would like to ask my colleague, C.S. Mushero, to also say one or two things, particularly to do with youth and care.
Thank you very much, Waziri. Mine will be brief. Really, during these 100 days, we have seen the use of technology increase significantly. We've also seen that as people use technology, I think families are straining to understand how to manage and to control how their kids are using either their mobile devices or their laptops or whatever technology they have. And so one of the things that we want to do as a ministry is first instruct the Communications Authority to work extremely closely with the internet service providers to ensure that the young people are protected, to ensure that the parents themselves know how they can filter some of these sites, You've heard previously Professor Magoha and others talking about the current issue we're having with pornography and other vices that are there online. And so we want within the next 7 days the Communications Authority and the service providers to give a very clear roadmap on how we're going to be training all those that are using technology to be able to ensure that our cyberspace is safe. We have also seen increase in fraud and other espionage and other things that are going on online that we must take control of. One of the key challenges as we grow is that we're going to continue to see use of technology as part of everyday life. A lot of people are now going on and they're starting to work online. We've seen many of the youth programs that we are working on already begin. We're in the process of training over 5,000 young people on how to go online and earn from the digital jobs. This is part of the Ajira digital program that we're currently working with the MasterCard Foundation as well as KEPSA to ensure that we're seeing a lot more people getting opportunities to even export their skills and jobs out there. So we want to ensure that the cyberspace is safe for everybody, and therefore we want parents to know that there are methods of being able to control also, what is viewable for the young people. I thank the media in terms of the content that they've actually been releasing out. It's been good to see that for the educational content, a lot of that is being provided by the broadcast media, both TV and radio, and that is really helping the families and keeping the children occupied in the things that they're doing. So Waziri, we've seen that growth, and we also just laud the effort that you've put in chairing us as the chairman of the National Emergency Response Committee on coronavirus, and we will continue to support you as you continue to drive us in this. So thank you very much. Asanteni.
Kwa hivyo asante sana, nimeshukuru waziri. Ni vile tu kuongeza kidogo niseme ya kwamba hizo siku 100 ambazo sasa zishapita, tumeona mengi. Tumefanya mengi, tumejifunza mengi, kwa sababu hii safari ilipoanza tulikuwa kusema kweli hatuelewi sana hii mambo ya coronavirus. Kwa hivyo mimi nataka kushukuru wale wote ambao tumesaidiana na audio tufike pale tumefika. Tulitoka pale ambapo kulikuwa kungumu sana, tuliona mambo ambao ilikuwa ajabu, tulisikia mambo ambao hatuelewi, lakini siku hizi tushajifunza kidogo mambo ya coronavirus. Madaktari wetu sasa wamekuwa wataalam maalum, wanaelewa ni kitu gani tunafanya, wanatusaidia sana. Tulikuwa hata hatuna reagents za kupima watu kama wana corona, tumepata hizo. Tulikuwa hakuna vitanda ya kupeleka watu wakipata hii ugonjwa, sasa tunaelewa. Tulikuwa ugonjwa wenyewe hatuuelewi, na ndio sababu tulikuwa tunapeleka kila mtu, tunampeleka hospitali. Sasa tunaelewa ya kwamba hata wale ambao wako hospitali, wale ambao wako positive, wakifika siku fulani, siku 14 hivi, wanaweza kukaa na watu hata wakiwa, kwa sababu wamepona na hiyo virusi haiwezi kuambukizwa. Kwa hivyo sisi tunataka kusema tulipoanza hii safari kuna makosa mengi tulifanya, na kuna watu tulipeleka quarantine ambao waliumia sana, lakini sisi kusema tu pole, kwa sababu sisi ni binadamu na mengi tulikuwa hatujui. Lakini Mungu ametusaidia, ametujalia, tumeendelea na kujifunza na kuwa ya kwamba sio tu Nairobi sasa ambao tunaweza saidia watu. Counties zimeendelea kujenga capacity yao, na sasa hivi tunagojea wiki hii ndio tuhakikishe county zote 47 hakuna hata moja ambayo haina uwezo wa kulinda watu wake vile sisi Nairobi tunafanya. Kwa hivyo mimi ni kushukuru tu watu wa magazeti, watu wa media, tumeshukuru na tukisema asante sana, kwa sababu ni nyinyi mmefunza watu vile wanafanya. Ni nyinyi mumeambia watu habari ya masks, ni nyinyi mumefunza watu kunawa mikono, kuweka social distance. Mambo hayo yote ni nyinyi mumesaidia sisi kufikisha wananchi hizi siku moja. Lakini hii safari ni kuanza, inaanza, sio kuisha, inaisha. Hii ni siku 100 tu, lakini siku zile zinakuja ndio nyingi zaidi. Kwa hivyo ni kuendelea kuwasihi. Tumeona ya kwamba siku hizi kuna hata soko ambazo zilikuwa na maji ya kunawa mikono, lakini sasa ni kama imekwisha, ni kama COVID imekwisha. Hakuna sanitizers ambazo zilikuwako, hakuna maji pahali palikuwa na maji. Na sisi tunawasihi watu, tafadhalini, mkiangalia, mkisikiza zile namba, ile kiwango kama saa hii nimetaja 250 hatujawahi kufika hapo mbeleni. Kwa hivyo hii ugonjwa sio hauendi chini, umeenea zaidi, unaenea zaidi. Kwa hivyo na sisi pia ni lazima tujikinge zaidi ya vile tulikuwa nafanya hapo mbeleni. Vile vile kuna wale watu ambao wanaendelea kuvunja sheria. Ukiangalia mambo ya baa, sisi tushasema jameni, baa zimefungwa, hazijafunguliwa. Na sisi tumesema wewe ukifungua baa, nilisema hivyo wakati nilikuwa hapa, nikaambia watu jameni, usifungue baa. Kuna wale wameendelea kufungua baa. Kwa hivyo kuna zile tumefunga, na tukifunga hiyo certificate, hiyo license ya health hutarudishiwa. Tukishukua license ya health ni kusema uwezi kufungua hiyo baa. Kwa hivyo kama umefungiwa baa na license yako ya health imetolewa, wewe sasa anza kufikiria ni biashara gani utafanya hiyo nyumba, kwa sababu hutarudishiwa hiyo license kwa sababu ya kuvunja sheria. Kwa hivyo jameni, tafadhalini, washeni tufanye hii kazi pamoja. Washeni tufanye vile mikakati ile imetolewa na serikali. Washeni tuone, kama nilivyosema, sisi zote ni watu wa corona. Na watu wa corona ni kumaanisha nini? Mtu wa corona ni yule anapigana na corona. Mimi ni mtu wa corona, wewe ni mtu wa corona, CS Musheru hapa ni mtu wa corona, kwa sababu anapigana na corona. Wacha sisi zote tujisikie sisi watu wa corona, sana sana kina wazee ambao leo nimewaambia ni siku ya kina mbaba. Sisi ambao tuna watoto, sisi ndio raini ya kwanza kuwa watu wa corona, kupigana na hii virusi. Nimeshukuru na nisema asante sana.
Helen Aura from NTV. With the success of this home-based care program that you said now you've released patients from Mombasa and Nairobi, so far as of today, how many people have died through who are receiving treatment on the home-based care, and how many recoveries do we have who are also receiving treatment through the home-based care? My second question is, there's still some politicians who are flaunting this COVID regulations that you've still insisted on, wearing of masks and the social gatherings as well. However, what is more evident is that a particular section which is allied to a particular faction is let easy, while the other section allied to a different faction is seen tear-gassed or being harassed. There are two set laws to this in this particular stance. And then the third question is regarding the ongoing Premier League. We see in the areas of the slum areas where they have the small rooms for viewing football. What set measures will you put to ensure that these particular individuals will follow suit to the set regulated measures that you've said? Because we know the space is not as big as the other areas around. Yes.
Thank you. My name is Emmanuel To from KTN News. Just one question to CS Musheru. Google and Apple have added the COVID-19 exposure notifications on both iOS and Android as a background update. How will the government use this technology, or just leverage on it, And is the government spying on Kenyans using this technology? Thank you.
My name is Chemtai going from Citizen TV, and my question is actually asked in a certain way. But of course, the use of technology. The country still has an issue with the data protection laws and the fact that there will be infringement of the people's rights and the rights to privacy. Just what, as you've mentioned, many countries, it has been a learning curve. The COVID-19 matter has been a learning curve for many countries in terms of here in the country and the use of technology in contact tracing, which you have mentioned that some people give wrong contacts and you have a challenge. How are you going to leverage on technology to ensure that you win the war?
Thank you.
My name is Motanu Banadin from the Daily Nation. My question is to the CS Kagwe. It's about mass testing. Now that we have increased capacity to do mass testing because of the increased resources, is the government planning to start another mass testing in the closed down counties of Nairobi, Mombasa, and Mandera? Thank you.
Okay. Thank you very much. Let me respond to those ones. I'll respond to a few, and then I will ask my colleagues to respond to the others. Let me start by Helen asking the questions that you are raising about the people who have died. As far as I know, nobody has yet died at home, thank God. But I'm going to ask Dr. Amoth to talk to that issue of home care and how we are doing it, and just the intricacies regarding that aspect. On the issue of wearing masks and politicians holding gatherings, let me say this. First, for those attending those gatherings, let me start by those attending the gatherings. This virus does not have a political party. This virus does not have a good side or a bad side. This virus does not know that side or the other side. This virus will kill you, irrespective of whose gathering you have gone to. If you come to my gathering and we are all together and one of us has the virus, you will die, or you will at least contact the virus. So my message, first and foremost, is when you are called by anybody, because nobody goes to a gathering at the point of a pistol. You go to a gathering because you want to go there. My first point is this. No matter who calls you for a gathering, do not go there. Don't go there, because eventually, when you are unwell, when you are going to a hospital, when your family is suffering, I guarantee you that whoever had called you will not be with you. You will be on your own. So on this one, I want first to start by challenging our own people, Kenyans generally. Do not attend these gatherings. Secondly, as far as I am concerned, there are no two laws in Kenya. The law is one. Nobody gathers anyway. Nobody should gather. And I think the enforcement agencies will do exactly that. And my view is that irrespective of the party, irrespective of of sides, whatever you call them, irrespective of any of that, no gathering should be allowed anywhere in this republic, because it threatens our people, particularly the spread of this virus. And the same case applies to the issue of football, that even if you are going to watch football, whatever, no matter how much you like football, no matter how much you enjoy football, you do so social distancing yourself, and especially wearing a mask. Because sometimes you are forced to be close in, but if you are wearing a mask, at least you have a chance, rather than when you walk without one. On the issue of mass testing, Mutanu, mass testing, as we have said, the intention is not to test for the sake of testing. That's why we talk about targeted testing, so that we go to areas where we know that there is a reason why we are testing those people. So the resources and the physical availability of reagents is simply not there for us to go to all the streets and test everybody. However, so far, the targeted sort of testing that we are doing is the one that is yielding the results that we can see. I want to ask first Dr. Amoth to talk about the home care, and then CS Musheru to talk about data protection. Or maybe you can finish first.
Yeah.
Okay, thank you, Waziri. You know, Waziri, one of the things that this COVID has brought, even for us in technology, is that we are seeing people are on gatherings. So now when you look at even funerals, people are now streaming them so that they're not all going to the same place. So we're being able to use technology in different ways, and it is helping us, you know, ensure we continue to keep our distance and we keep safe. The data protection law, privacy and data protection, is a law already, and hopefully in the next 2 weeks or so, we should have recruited a data commissioner who is going to be ensuring that the privacy of everyone's data, this is the personally identifiable information, is actually managed and controlled, whether it's going into buildings or whether it's mobile operators or banks or anybody that is holding your data. We're very clear that we want to protect people's privacy, but even as we do that, when it's a health issue, when it's a security issue, we ensure that you know, the public safety comes first. You've asked a question that Google and Apple have introduced an app that is giving people this information. As a country, we have actually had contact tracing for a very long time. It is not new. You know, we've had issues of security, whether it is terrorism. And so if you know that, you know, there is a group of people who are discussing issues of terrorism, we've been able to look at ways of contact tracing. Apple and Google are primarily providing an app that is on the smartphones. In Kenya, we have actually many more phones, you know, the feature phones. And so as a country, we're prepared for much more than just the smartphones. It is a good product and service that has been added so that you can tell, you know, where you've gone, but they don't have specific information. So for instance, unless the Ministry of Health has provided data to say so-and-so had COVID in such and such a building, then it's difficult for them to give that. Or you as an individual, you have volunteered that information to say I'm COVID positive, and therefore, you know, your information and where you've been is accessible. As government, we can't rely on only a subset of information. We have to rely on the full data. We are taking care of the whole country. So we are working on that basis. We're following the law in ensuring that the way we use data allows us to be able to ensure that we're providing first the privacy that people have asked for, and also ensuring that we have the security. Technology is here with us. It's not new in some of these areas, and we will continue to use it. And I hope I have answered the question fully. Expect the new data commissioner to come in, as I said, within the next 14 days. And that will be, again, a new area for everybody to look at. When you go into a building, at the moment, the security people take your name and your ID. These are things that will begin to change because you don't want to make sure you're exposing people's information. So we are cognizant of that, and I believe Kenyans will be safe. Thank you. Dr.
Thank you, Waziri, CS Health, CS ICT. Mine is just to give a highlight on home-based care. And we had discussed this before when we told you that these guidelines were developed by the World Health Organization. And our case management team looked at the data that came from WHO to customize them so that they can be able to fit our scenario back home. The criteria of paramount importance is that, one, you must test positive for COVID and be confirmed by a laboratory test. Number two is that you must be asymptomatic. You have tested positive, but you don't have any symptoms. Number three is that you don't have any existing comorbidity or any existing medical condition. And further, we have drilled down to ensure that you have suitable space, probably a well-ventilated room where you can be able to stay on your own. separate toilet and bathroom facilities. You must have a caregiver who can be able to check on you. You must have separate linen, separate utensils, all which are espoused in the home-based care guidelines. Today, Waziri talked about 550 people who have proceeded on home-based care from the two major institutions that have served many of the COVID-19 positive patients. That is Kenyatta University Teaching Referral Hospital and Coast General Hospital. And so far, we are getting good information from the ground. We have not had any mortality. And out of these, 50 people have already been discharged from further care. These home-based care guidelines came about because of the increased number of cases and the limited healthcare facilities that could be able to take care of these people, more so that most of them were symptomatic. Home-based care is not a new practice in the field of medicine. It has been done previously and very successfully for HIV/AIDS. What is important is that it places a premium on the person who is undergoing home-based care to be able to be a responsible citizen. So if you are to stay at home, then strictly you must stay at home without exposing the rest of your family and the general public. And that is why we are trying to link all cases of home-based care to community health volunteers and the healthcare workers at the county level, and also their caregivers, by giving them appropriate information that can be able to empower them so that they can be able to make correct decisions. We also appeal to the public, who are supposed to be the public police, to ensure that if you are undergoing home-based care, then you do home-based care according to what the rules and protocols say. Further, we have also developed monitoring and evaluation criteria so that we can be able to get weekly reports, and also the linkage with the facilities, so that in case you are undergoing home-based care for COVID-19 and you develop symptoms in the course of the disease, then you can be referred quickly to a facility for further follow-up. So we are implementing this, doing it very, very cautiously, and applying the rules to the letter to ensure that you don't expose your family members or the general public to the risk of transmission of the disease. And I'm sure going forward, we'll be able to perfect the home-based care management based on the information that we are getting from the cases that we are putting through that process. Thank you.
Thank you very much.